Many thanks for joining us. This is the news at 7 on NT International. We're live in Abuja and I'm Ruth Aguele. First, the headlines. Discharged. As federal government appreciates goodwill from Nigerians in the fight against COVID-19, senators resolved to contribute 50% of their salaries from March 2020 to boost response to contain coronavirus disease. Economic, Social and Cultural Council of African Union applauds strategies deployed by Nigeria to curtail the spread of coronavirus. Let's begin with Cherry News. Lagos State Government has discharged 5 coronavirus patients at Infectious Disease Center Yaba Mainland Hospital. NOSA also reports that this brings to 8 the total number of discharged patients from the center.
Quarantined at the isolation center for weeks, looked stable and unruffled. The discharged patients expressed joy and satisfaction over the treatment they received. Speaking to the media, one of the patients told people not to panic as the virus could be defeated. While thanking Governor Babajide Sanwo-Olu for his support and proactiveness, they pleaded that the workers at the center should be given life insurance.
I came in here on the 15th, but after the test proved inconclusive, was asked to come back the next day. And that next day, I was admitted alongside of some others. Things turned out to be fine. We were taken care of by the officials, the health officials on ground, and all our complaints were attended to. And now, I'm a living proof, a living witness alongside my other colleagues that we can beat it. We can beat it. And I want to assure others that this is not their home, this is not their resting place.
Because from the second day I came here, there was improvement up to this moment. So thank you guys.
It would be recalled that Governor Babajide Sanwo-Olu had earlier in the broadcast said that some patients who previously tested positive would be released if their confirmatory tests are negative. In Lagos, Nosa, Osula, NTA News.
And still on containing the spread of the coronavirus, the federal government has directed the cessation of all movements in Lagos and Abuja, the nation's capital, for an initial period of 14 days. Now, the lockdown, which also affects Ogun State due to its proximity to Lagos, begins at 11 p.m. on Monday, that is today, 30th of March. President Buhari Muhammadu Buhari, who gave the directive in a nationwide broadcast, said the measure is aimed at containing the spread of the coronavirus pandemic in the country. Let's hear from State House correspondent Adamu Sambo.
The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis.
As a nation, President Muhammadu Buhari said Nigeria's response to COVID-19 must be guided, systematic and professional. And in doing so, he emphasized there is no such thing as overreaction or underreaction, rather the right reaction by critical institutions of government and experts. He said with Lagos and the FCT having the highest number of confirmed cases of coronavirus, cessation of all movements is imperative.
All citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states.
The restriction order, he said, does not apply to institutions and individuals on essential services. President Buhari explained that the federal government is fully aware that such measures will cause hardship and inconveniences to many citizens. He was, however, quick to add that with the dreadful situation in other parts of the world, this is a matter of life and death.
We must all see this as our national and patriotic duty to control and contain the spread of this virus. I will therefore ask all of us affected by this order to put aside our personal comfort to safeguard ourselves and fellow human beings. This common enemy can only be controlled if we all come together and obey scientific and medical advice.
President Buhari announced various palliative measures to ease the pains of those whose livelihoods will be affected by the restrictive measures in the coming weeks, while directing the Ministry of Humanitarian Affairs to develop strategies towards sustaining the school feeding program during this period. The President also ordered the immediate implementation of a 3-month repayment moratorium for all trader money, market money, and farmer money loans.
I have also directed that a similar moratorium be given to all federal government-funded loans issued by the Bank of Industry, Bank of Agriculture, and the Nigerian Export-Import Bank. For the most vulnerable in our society, I have directed that the conditional cash transfers for the next 2 months be paid immediately. Our internally displaced persons will also receive 2 months of food rations in the coming weeks. We also call on all Nigerians to take personal responsibility to support those who are vulnerable within their communities, helping them with whatever they may need.
The federal government, he said, is committed to doing whatever it takes towards confronting COVID-19.
I want to assure you all that government ministries, departments and agencies with a role to play in the outbreak response are working hard to bring this virus under control.
President Muhammadu Buhari thanked all healthcare workers and other essential staff on the front lines of the response against the global pandemic for their dedication and commitment, describing them as true heroes. From the State House, Adamu Sambu, NTA News.
Following that broadcast, Nigerians are reacting to the federal government's COVID-19 response strategy conveyed in President Muhammadu Buhari's broadcast to the nation. Onenge Faye is interfaced with some experts to get informed opinions.
Traders' money, like he has said, and also conditional cash transfer. The data available in those schemes are the first line of data that could be used for implementation. From then you can now expand to bring in the people that have not been covered under the palliatives, because it is very difficult. It's a challenging thing to be able to bring in the vulnerable into that scheme. So the palliatives will first use you say you work from the known to the unknown. Therefore, you use the known data which came out of traders' money, conditional cash transfer, and other social intervention programs that the government has done before. So that is the first source of data for implementation. Then you now expand, as the case may be, to be able to bring in the people that have not benefited before, because the palliative should reach everybody who is vulnerable and supposed to access that scheme. People who have also accessed most of these interventions that have limited time, expected period of repayment. The moratorium with the pandemic now, it will cut short that moratorium where even the activities have not been commenced. So the extension is very, very handy. I think it will help the companies, the borrowers, whoever have benefited from those schemes, to re-strategize and reposition its financial flows to the extent that you will be able to repay the loan as at when due, if the moratorium is extended.
Remember, one thing that also came out of the present speech is that there is no definite curative treatment for this disease. So the best answer is that of prevention. So we must prevent. How do we prevent? And normally, summarize this in two aspects. There is protective aspect of training. Prevention, where we are told to wash hands and use sanitizers and make sure that anybody coming up must stay away. That social distancing is very important, and I call on Nigerians to actually follow what our president has told us in line with the guidelines. Social distancing is really very important. The lockdown that is currently being in place is one of the most effective ways of preventing the escalation of the virus. So it is really very important. Another aspect that we must also not negate is the fact that our bodies must be equipped through our immune system to fight the disease. Should you get unlucky, despite the preventive measures that you have embarked upon, and the virus gets into you. After all, it is when the virus gets into the body that it uses the body cells to actually multiply, and then the individual can consequently infect other people who are close to them. So making sure that we boost our immune system is very important.
Experts there reacting to the president's broadcast to the nation. Nigeria has recorded a second death from the coronavirus pandemic. Minister of Health, Dr. Osage Ehanire, confirmed this at a media briefing in Abuja by the Presidential Task Force on COVID-19 in Abuja.
Sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts, and also isolate and treat in order to reduce the spread of the infection.
Task Force and Secretary to the Government of the Federation, Boss Mustafa, appealed to Nigerians to cooperate fully with the 24 hours lockdown in Abuja, Lagos and Ogun states, as announced by President Muhammadu Buhari.
It's a total lockdown, except for essential services, except you are going to access specific needs like medical needs, except you're going out to buy food. All those things were categorized in Mr. President's speech. Nothing would happen to us if we lock down for these 2 weeks and allow for the tracking of those that have been in contact with those infected, so that we do not transmit to community transmission.
And joining me in the studio to look at some thematic areas on the lockdown is Dr. James Komolafe. He is a behavioral expert. Thank you very much, Dr. Komolafe, for joining us.
Thank you so very much. Good to be here again.
All right, so this lockdown, how will it affect the psyche of Nigerians, bearing in mind that, most people work in cities away from their families?
Well, the lockdown has come, and it's very imperative for this time, except that people will have to realize that the presidential speech is very vital, and Article 15 and 16 of it is critical for the lockdown. That talking about the two stages approach of the government, the protection side and the preservation side. That is the government side. The people must realize that they have to create their own side of the production. So we have the protective, the preservation from the government on one hand, and then the productive side from the people's end, because isolation or lockdown for 14 days is both a loaded and coded content for which every citizenry should prepare, not just to isolate abstractly. They have to isolate to create values and produce incentives that will motivate them throughout this 14 days shutdown. That is why the coping mechanism of every individual and family is integral at this moment. And my team and I has come up with a global concept to help everyone
Okay.
who wish to try their hand on knowing what to do, how to do it, so that at the end of the isolation period or lockdown for 14 days, they will come out sounder, brighter, and much more vibrant.
Dr. Kamala, Faye, sorry to interject there. Now, yes, your team is there, but and I know the whole measure is to ensure safety of people, but there are still people who will be bored, you know, people who will deal with conditions like boredom, depression, you know, due to inactivity within this period. What would you advise?
Yes, I will advise, like I said, that, you see, don't just take isolation just as isolation and you are just waiting for the next thing. You have to create value creation incentives for yourself to ensure that your energies are properly focused to developing yourself, knowing where to cross your T's and dot your I, find out where your strength lies, see where you have failed before, look at things you can do to keep yourself together intact, and then don't sit down in one place. So the coping mechanism assessment test is out for you to be able to take a test and see what happens and how to navigate throughout the 14 days period, so that at the end of the day you are not bored, you are not sad, there's no panic, there's no such attacks on you. So it is a strategy that will help you to be exactly who you are meant to be and to have a time to reflect, build on your energy lanes so that you can be stronger at the end of the day.
Indeed. Thank you very much, Dr. James Kamala Faye. We want to come out stronger at the end of this lockdown. All right, let's take a break. We'll be back shortly. Stay with us.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
That channel where you watch just now don't waka, no panic.
There's me no panic.
You go do it by yourself like ABC. Oh yeah, press the menu button on top your remote. Scroll up and down till you see Information Central. Then press OK.
Press OK.
Check the signal strength and quality. If the signal strength and quality pass 70, make you press the exit button, go back. Go advanced options, then choose installation, then go to reset and press OK.
Press OK.
Wow, now you self fit catch all those channels will be one miss road by yourself. Yes, make your group for no loss. You see as I do, Abi?
And I see as I do,
Go TV. Live it. Love it.
And I see as we do,
Thanks for staying tuned. Ahead of the lockdown of the Federal Capital Territory, people have besieged automated teller machines service centers. Austin Ayembe went around the city and brings us this report.
A visit to some of the banks and other ATM service points showed congestion and long queues, with many people saying they have spent hours waiting to make withdrawals.
Particular point, I haven't been quite long here. But I went to several other places and the queues were just unimaginable. So I began to hunt around town for where I could see a shorter queue.
In some of the banks visited in the early hours of the day, the automated teller machines were not dispensing. Many who wanted to enter banking halls had to wait for hours because they have to go through several checks as part of measures against the coronavirus pandemic put in place. The stress notwithstanding, some said the measures taken by the government to lock down the city is for public interest.
But what I ask is that can a sick man go out? No matter how hungry he is, how much he wants to make money, if he's sick and is bedridden, he can't go out. So maybe this is the sacrifice we need to make. Like the president said, we should be each other's keeper. I think this is about time that we should be each other's keeper.
The Federal Capital Territory is expected to be locked down from 11 p.m. Monday, 30th March 2020. In Abuja, Austin Anyebe, NT News.
The Economic, Social and Cultural Council of the African Union has applauded the strategies employed by the present administration to curtail the spread of the coronavirus pandemic in Nigeria. Chairperson of the council, Dr. Tunji Ashaolu, said this in a chat with our correspondent Adebola Brookslyn Sunday in Abuja.
It's coming at the right time. As a matter of fact, this is the best speech so far.
Dr. Tunji Ashaolu was speaking against the backdrop of President Muhammadu Buhari's national broadcasts to Nigerians on the coronavirus pandemic.
It means well for the citizen, and the citizens to also cooperate with him. So I think it's a matter of life and it's a matter of safety, because life has to come first.
On the fake news making the rounds that federal government is giving financial incentives to Nigerians, the chairperson said,
he did not talk about that he's going to give some amount of money to some set of people. For everyone to also be careful, because I know that some elements are there outside there to take this opportunity against some people.
Dr. Ashaolu also highlighted the council's position in supporting government's efforts to combat the deadly COVID-19.
It's ongoing Africa Joint Continental Strategy for Coronavirus. And the role of ECOSOG in this is for us to also make sure that decisions that have been taken at this level, for us to take it down to the grassroots, to make sure that the citizens are well informed and the citizens also know what to do, and also they are keen into the guidelines that have already been laid down by World Health Organization and of course by Africa CDC.
The council is an advisory organ of social and professional groups of AU member states. Adebola Brookslyn Sunday, NTA News.
All right, let's find out what the global situation is on COVID-19. Again, Adebola Brookslyn Sunday is our guide.
Hello there. It's the third month that the coronavirus have been ravaging the entire world. A disease that began in China has now made the United States of America its throne, where the confirmed cases have risen to over 142,000, with 2,000 deaths and about 27,000 in critical condition. Italy is the worst hit by the virus, with over 97,000 confirmed cases, while over 3,000 people are in critical condition. Spain, which has over 80,000 confirmed cases, recorded over 537 deaths in the last 24 hours, bringing the total number of deaths in the country to over 6,800, while over 4,000 are in critical condition. In the Middle East, Iran is on top of the table with over 38,000 confirmed cases, over 2,600 deaths, and over 3,200 are in critical condition. Africa appears to be the less affected continent with the coronavirus pandemic, which has affected 46 countries, over 4,600 cases, 146 deaths, 335 recoveries, and 8 of them free from the virus. South Africa maintained the top of the table in the continent with over 1,200 cases, 2 deaths, and 7 people in critical condition. Although Egypt has about half the confirmed cases in South Africa, but has the highest number of deaths in the continent, with none in critical condition. Algeria is just below the ladder with 31 deaths, over 500 confirmed cases, with none in critical condition. Despite its grip of the world, the good news is that over 156,000 people have recovered from the virus worldwide, including Canadian Prime Minister Justin Trudeau's wife, Sophie, Remember to always wash your hands with soap and water, observe social distancing and other preventive measures to stay safe from this unseen enemy, COVID-19. I am Adebola, Brooksland Sunday.
Thank you, Adebola. Back home, Nigerians, excuse me, Nigerian senators have resolved to contribute 50% of their salaries with effect from March 2020 to support the response to contain the spread of coronavirus disease in Nigeria. A statement by the acting spokesperson of the Senate, Senator Godiya Akwashiki, said the decision was reached after consultations following a review of national efforts already in place to contain the pandemic. The statement explained that the support from the Senate will be sustained until Nigeria is declared safe from the ravage of the deadly disease. It commends steps taken by the federal government towards mitigating the plague, and the Senate is ready to do whatever is required of the legislature to stem the spread. The Senate appreciated Nigerians for the show of understanding and complying with professional and executive directives at this time. That's all on the news. Many thanks for your time. I'm Ruth Aguela. Bye.